That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Well, hello and welcome back to another episode of the Real Health Podcast with Brandy and Amir. I'm Dr. Amir Rashidian, a chiropractor, and Brandy is the main reason you all watch the show, I'm sure.
I'm the one with flat hair today. It's due to the weather.
Oh,
Don't judge me.
It's a bit rainy.
Yes.
Yeah. We were just talking about how summer ended really fast. Before we keep going, I want to introduce Dr. Tia Perry. She is joining us today by request. We've been really wanting to have a nice conversation with her. She's an amazing veterinarian, but you're going to learn some special things about her in a minute. Before we go on, I want to tell you what our podcast is about, and this is where we bring you real life, real world, up-to-date information about health and wellness. We want to tell you what it means, how to apply it to your life, and how to use the information to make yourself and your family feel better, get stronger, live longer, and feel younger. And normally we go through articles, from different mainstream media outlets, and we kind of talk about what's coming down and what the new discoveries are and so on. But every once in a while, we have a special guest. And so today, this is going to be amazing because Dr. Tia is not just your average veterinarian, which is already a special thing, but she's a whole lot more. So can you tell us a little bit about like your background and what got you into your field, and then we'll go from there.
Sure. So I am what's referred to as an integrative veterinarian. I did have to go through and do standard veterinary school, which I completed in 2014. And then after spending a few years in routine practice, I started getting interested specifically in geriatric management. And one of the biggest problems that we have with geriatric patients is mobility issues.
Oh, yeah.
So in looking into that, I discovered an emerging world within veterinary medicine that is referred to as the integratives. And that can be anything from physical rehabilitation to acupuncture to herbal therapy to manipulative to massage. And just like within human medicine, there's a whole host of different places that you can go for training. But I started my integrative journey in 2017, going and getting my canine rehabilitation therapist certification, and then found acupuncture after that. And the institution that I went to that I got my acupuncture certification in became the first integrative school to have a full master's program. And so they have a master's in traditional Chinese veterinary medicine, a master's in canine integrative medicine, and a master's in equine integrative medicine. Because even within vet med, the species can be so unique that oftentimes once you get beyond basic medicine, you do need to have a much deeper understanding and foundation. And last September, I graduated with all 3 masters.
Wow.
So I have...
That's incredible, Dr. Tia. I'm pretty sure there are not many that are able to do that. That's tough.
I was the first in the school.
Woohoo! Look, we have her here, guys.
That's great.
That's amazing. So that's an accomplishment.
And did you always know you wanted to get into the veterinary field?
I knew I always wanted to work with animals. My original goal was marine biology. I'm a decent swimmer. I really don't like the cold though. And
we were just talking about that.
So when I eventually figured out that most of the animals that I wanted to work with need, a lot cooler waters, I started looking at other animal options, and that kind of led me into just general veterinary medicine.
Yeah.
Very good. Well, I know we had a really cool experience with you. We've had several, but Dr. Tia actually performed our dog's when we got her fixed. So remind me, what's the surgery?
The medical term is the ovariohysterectomy. The common term is the spay.
There we go. I always get the spay and the neuter confused, but it usually comes out in the end. We figure it out because there's only one or two. And you did something really cool. You included her in a study that you were doing at the time with acupuncture, correct?
So yeah, that was actually a part of, so with most master's programs, you have to do some sort of either research or what's called a capstone. And for the traditional Chinese veterinary medicine master's, I had to do original research. And there are a couple of acupuncture points that are on the body that can help to manage and regulate the circulatory system and inhibit bleeding. So I was looking at the use of acupuncture and stimulating those points prior to bleeding happening to seeing whether or not we could reduce intraoperative bleeding, and actually found about a 60 to 70% reduction in bleeding
That is
through the use of
unbelievable.
acupuncture just before surgery.
And we also learned that our dog had a very cute little uterus.
She did. I got lots of photos of it.
That's right. So fun. Never thought I would be talking about my dog's uterus, but it was very cute indeed.
You,
So
you know,
I saw the
when I
pictures.
was in chiropractic school, and this doesn't have to do with animals, but it does have to do with acupuncture. So I met a doctor. One of the instructors was telling a story about how he traveled to China to learn about acupuncture, and while he was there, they were going to do a demonstration where they were going to do an appendectomy on a human without any anesthesia. So they were just going to use acupuncture needles to completely sedate, numb the area, and take out this person's appendix. Well, he got there and they said, "Oh, sorry, the surgery's been canceled." And he was really disappointed because he said, "I traveled from the United States all the way out here to see this specific surgery that I can't get to see anywhere else, and now I need to go back and I'm not going to see it." And as he was walking out, they said, "Actually, we have another patient who's going to do it, so you can come back." So then he watched this entire surgery with acupuncture needles. No anesthesia was given. They did the appendectomy. And then it turned out that it was one of the other instructors who just volunteered and said, "Well, if we have someone from the United States, take my appendix out." And he just volunteered for this surgery.
We don't usually recommend that. If you have an organ, it's there for a reason. So maybe we don't just give up body parts. I don't know. That's
right.
me. But
I would.
in the name
think
of
the same.
science, maybe.
That is very that is very unique preventative care. Like, you never know when that thing's going to go bad.
Right.
We'll just take that
Take
out.
it out. You know, and I was listening, because speaking of how every organ is powerful and important, someone, Dr. Bruce Lipton, was given a lecture, and he said the tonsils are not part of they are part of your immune system, but they're actually receptors because they tell your brain and your nervous system something that's coming in might need an immune response. So when you take those out, you're taking out the eyes, like you're taking out the bouncers, so to speak, in front of the bar, you know, that check to make sure, hey, whatever's coming in is good, so they can signal and tell the rest that my tonsils are out. So
Yeah, they took mine out early on too. So I guess it means keep your tonsils if you can, people.
if you can, keep it. So what's your favorite animal to work on and why?
We won't tell the other ones you said so.
Everybody always says that this is such a cop-out answer, but it's genuinely the truth. I really don't have a specific favorite. I would say that the most common animal that I work on is dogs, because that's the most commonly owned pet. And that is the animal that, because we have domesticated dogs to such an extraordinary degree as companions, rather than like specifically working animals, competitive animals, things like that, I get to work on dogs a lot more. So my confidence is there with dogs much higher than other species. But even though I work on dogs more, there have been one or two horses that have just absolutely stolen my heart. And there's actually one cat that is at the very top of the list.
Wow, that I would not have guessed.
So it really comes down to the individual animal and the bond that you can create with them. Because with the integratives, you know, I don't just, you know, I'm not sitting in an office where somebody comes in and they say, "Hey, doc, what medicine can I take home?" And I'm just like, "Well, you know, here, take this and let me know how it goes." My services, very specifically, I'm in people's homes. So I go into their house. I'm there for half an hour to an hour, sometimes 2 to 3 times a week, depending on the animal, what their needs are, what I'm treating them for. And I mean, there are animals that literally I sometimes wonder if I spend more time with that animal than I do my own dogs. So, I mean, you know, that one particular cat, that cat started almost paralyzed. Like somebody had dropped a book on that cat, and it was very, very unfortunate. It was a 19-year-old cat. They couldn't pursue surgery. We tried acupuncture as a Hail Mary, and that cat got to the point where I would pull up in the driveway and that cat was sitting by the front door waiting for me. So
That's
I
amazing.
mean, it really is. So
Well, and we've seen it with our pets. We've had our dogs adjusted. He's not the one that does it. Actually, in the state of Maryland, that is not legal anyway. You do have to have a separate licensing for,
Yeah.
adjusting humans versus
Right.
manipulating.
And if someone is a chiropractor, they want to work on animals, they actually have to go through an entire veterinary school. They have
Yes.
to do all the years of veterinary school before they're allowed to.
Yes.
That's not quite accurate.
Is that
there,
right?
There are certification programs that chiropractors can go
chiropractors.
through.
Okay.
Now,
Nice.
the difference is that as a animal certified chiropractor, you cannot diagnose anything. The only way to reach a diagnosis is to be a veterinarian.
I see.
So if you had an animal that you were working on and you were like, man, I really bet that this animal has a blown disc, you can't say that. All that you can say is that there is
Something wrong.
a limited range of motion at T4, T5, or, something like that.
Got it.
So yes, if you want to be able to go through, and you can't make any recommendations for medications, either
Right.
over the counter, herbals, anything, unless you are a veterinarian.
Right.
So
That makes
technically you
sense.
can do some work
Yeah.
and you can do body work, but you can't make any diagnoses and you can't make
Right.
any medical recommendations other than you should really go see your vet.
Right.
Like
Yeah.
that's it. That's
I mean,
kind
that
of where
makes
you
sense
get
because
limited.
there's so many animals, and then there's so many different types of just dogs and cats.
Right.
If all you work as dogs and cats, there's still horses too. There's so many different types. I mean,
Yeah.
I
It's not like the human spine where
No.
really it doesn't matter if you're a man, a woman,
Child, an elderly,
where you
yeah.
come from, your spine is your spine. And so there can be some anomalies there for sure, genetically or from trauma, but you're not going to see vast differences, you
Yeah.
know. So I can see where that would be super valuable. So
Yeah, I mean, it's really neat because when you look at their skeleton, you know, like what the matching part in the human would be, but they're still very different.
Yeah.
They have different shapes and so on. They 7 cervical vertebrae, right, in dogs,
Yes.
and then
And
13
horses.
thoracic.
and
or
giraffes,
Giraffes, that's right.
they're just much larger.
Yeah, you would think a giraffe would have like 30
Yeah.
vertebrae
Yeah.
in their cervical spine, but so and then all necks in most mammals apparently have 7.
Yep, that's pretty consistent. Now, when you get to the thoracics, there are 13 in the dog. There's 18 in the horse.
Oh wow!
Oh, interesting.
Yep.
And a snake has 200.
Yeah, I don't know what a snake's got.
I'm not going there.
That's not a mammal. Just-
Snakes take a really long time to adjust. I've done it twice.
Oh, really?
Yes.
Let's hear about that.
Okay, because I thought you were joking. She's really adjusted.
Was
to
it a
snake.
python? What was it?
It was a ball python. And it was down at the program that I go to. Somebody showed up with a snake, and like literally because it's just this really long string, you just sit there.
No kidding.
And the snake is okay with it.
Just like any individual, if you do find a restriction, you have to take it to tension in
Yeah.
order to be able to get your HVLA. Sometimes that can be tight. They have a huge mass of musculature that's in there. So if you find a trigger point, they're not going to be happy with you, but you still have to find a way to work it out.
Right.
So it just depends on the snake. But this particular snake was
So if you're wondering, high velocity, low amplitude is what HVLA stands for, which is a quick, small movement to correct vertebral subluxation or misalignment.
That's just fascinating.
So
Sorry,
the
I'm
snake
trying to
was,
envision this.
Was complaining about constipation, or was it having back pain?
it was brought in as a joke, and we actually found stuff.
Oh wow, got it.
Wow.
Oh, there you go.
And we say that all the time to
All
our
the
patients,
time,
right?
right,
Like you don't have to feel a misalignment.
You have no
You-
idea what's going on inside.
I
your
know. There's only so many areas of the body that actually send and receive pain transmissions.
Yeah.
So if you don't have pain receptors in that area, you may not know that there's something's not firing properly, or there may be nerve impingement. So important. So if you'd like to bring your spines in as a joke and have us check, we are happy to do that. But I don't think we've found a spine that didn't need adjusted.
Well, yeah, well, X-ray and
So.
see. X-ray, see what you look like. And
So
run some
funny.
tests.
So let's talk about what are some of the most common health challenges that that pet owners miss, because I think when I first asked you to come on during this time, because we were talking a lot about athletes, I really consider, especially dogs, horses, things of that nature, they are athletes in and of themselves. Now, like you said, we have where dogs used to primarily be used for work or things like that. We have a lot more individuals in our communities and our culture now that they have them as companions, which is fantastic. However, they may not be getting the exercise that they need. They may not be getting, I think dogs need to be pretty active, and maybe that varies per breed on what they need. But there's a lot of work breeds out there that people have as companions. And knowing what I know about the human body, I would say I would be concerned with lack of activity leading to some of these health concerns. So what are some things that people should be looking for, or things that commonly get missed with our household pets?
So I would say the number one thing that probably gets either written off or dismissed is dental problems.
Okay.
Most people do not realize that when your dog's teeth start to get yellow, most people are like, that's normal. They're just getting, that's not normal. That's bacteria that's creating a biofilm that hardens and becomes plaque.
Oh, wow.
And just like with people with long-term plaque accumulation, sometimes you get a little bit that chips off, it goes down, it's in your stomach, and now you've got this bacterial population that's in the stomach. It will absolutely set them up for early onset cardiac disease, kidney disease. It's painful in the mouth. The gums get red and inflamed. You can develop tooth abscesses from it, which wind up becoming medical emergencies, because the only way to deal with a tooth abscess is to then extract the tooth. So a lot of people don't realize that, because we see pictures of dogs out and panting and they have that brown line right along the top of their tooth. Most people don't realize that is genuine dental disease.
Oh,
and it really can impact the overall lifestyle of the animal. So especially when you have like some of these high activity working breeds, if they have gingival inflammation and you're asking them to go out and retrieve something, or, you're trying to play tug of war with your dog, like sometimes people notice that like there's a little blood on the toy. That's not necessarily normal. Your dog's gums are pretty hard. They should be able to withstand most normal chewing. So then when you start seeing like this little bit of bleeding, it's, those gums are inflamed and irritated.
So what should we be doing as dog owners to ensure that we're taking care of their dental health?
Brushing is actually very helpful for dogs, and you don't have to have crazy toothbrushes or toothpaste or anything like that. I actually brush my dog's teeth once a day with either a dry towel or a piece of gauze.
Okay.
You want something that's absorptive that will kind of draw that tartar off of there, because like for us, when we brush our toothbrush is not absorptive, but the idea is that it breaks the plaque off, and then what do? We rinse,
it
we
out?
spit.
Uh-huh.
Your dogs can't do that. So you want something that's going to kind of absorb it away a little bit. You do need to be careful and should go into your vet clinic to kind of get appropriate training on how to brush the teeth.
Okay.
And it's not crazy. It's not like, all right, well, first you have to do this and then you have to do that. Like it is just a gentle brushing. But, since we're already dealing with animals that most likely have some degree of dental disease, you can rub those gums raw. And just like with us, you can create gum recession that can expose the roots and then lead to needing a extraction. So
that really impacts their quality of life, because without their teeth, they're not able to so much. Their eating is impacted, their grooming is impacted. Like there's so much that can happen, their playtime. So yeah. What else have you seen that
I'm just fascinated because like, you basically as a veterinarian, you have to be an animal dentist too. So you're an animal dentist, you're an animal internist, you're an animal dermatologist, you're an animal neurologist,
Yep.
You're an animal orthopedist.
Well, and then outside of that, you have your general practitioners, which do wind up having to, have a pretty extreme breadth of knowledge. But then there are specialists that we can often refer to as well.
Okay.
And just depending on where you're located and what specialists you have immediately available. But I mean, not everybody wants to go to the specialist. So because that
Right.
does require specialized training, which means the specialists are more expensive. So yeah, as a routine care veterinarian, I am a surgeon. I am a dentist. I am an internal medicine specialist. I'm an ophthalmologist. I am an ear, nose, and throat specialist. I am a neurologist. And you
Yeah.
never know what's going to walk through the door on any given day.
And you're a mobile provider.
Yes. Now, as a
top of
part of
that.
my mobile practices, I don't offer any of those services, but I do provide relief work at some clinics. So I do still offer those. And that's how I was able to do the spay for your dog. I
Yeah.
do relief work at that clinic.
Wonderful.
So
What are the types of, and I want to get back to some of the common things that we miss, but what are some of the types of conditions that someone would have you come to the home to help them with?
the most common thing I go to the home for is usually some sort of mobility issue.
Okay.
That's the number one thing that people think of for acupuncture, manipulative services, adjustments, because that's, when humans go to see those types of specialists, that's what they're looking for is pain relief.
Right.
But acupuncture is a full medical system that you can technically treat ear infections, eye problems, GI problems. I've got several animals that I've treated with acupuncture for cancer and doing general cancer pain relief.
Wow.
So pretty much the only thing that acupuncture cannot be supportive of is a broken bone. It's not going to accelerate a broken bone. It's not going to change the trajectory of a broken bone. It'll help provide pain relief around a broken bone, but you do definitely still need to get that set and pinned by a regular vet.
Yeah. That's amazing.
So when you go to someone's home and let's say the dog has a limp or the dog isn't using one of their legs properly, you can tell they're uncomfortable. So for us, human chiropractors, there's certain guidelines we look at. Like we know that if the head is turned to one side and the leg length changes, that means there's tension on the brainstem. As you put pressure on the brainstem, the body will wind and turn to reduce that tension, so the pelvis will rotate. And you go, okay, if the head is turned this way and the legs are uneven, but if the head's turned the other way and the legs even out, well, we know I need to adjust this side of the neck and so on. Obviously, that's if we don't have x-rays and we haven't done that type of analysis. Now, with animals, they're not going to hold still for an x-ray and then open their mouth so you can get an open mouth view so you can see the atlas and any of that stuff. But there are assessment techniques that are different for them. What are some of those look like?
That's going through and doing our manipulative exam. So every bone and every joint that we can put through range of motion, we do. So, and it's just a matter of just going through, feeling. And when you find something that isn't moving the way that you expect that it should, you take it to attention and you do your adjustment. Now, some of that also does come with some degree of intuitive understanding and knowing what the animal's history is. So if this is a Dachshund that has a restriction at L3 and has a history 2 years ago that he had a hemolaminectomy and we had to take a disc out, that's probably fused now. Don't touch that. Don't adjust right there. That's not going to be a good idea. So some of it is just knowing the history of your animal. Some of it is knowing the activity of the animal, and a lot of it just comes down to that physical touch and just, you're right. We don't typically have the ability to go through and take the precision x-rays that you can with people. So we wind up having to go through the animal every single time looking for what's changed, what are the differences, where are your restrictions. Some animals do develop the same restrictions every single time because maybe they do have a leg that's a little shorter. Maybe they do have a hip that's hiked a little bit. But some animals, it's, biomechanically, they're fairly normal and they just fell off the couch this way.
It seems like animals are way more...
Resilient?
No, I won't say. Well, okay,
That's
sure.
true.
They are resilient. They adapt better to the environment than humans. I'm sure and I think a lot of that is they're always happy because they don't worry about the future and they're not depressed about the past. I know there's loss and grieving in animals, so I'm not discounting that. But I feel like we had a dog who had which one was it? That the back legs weren't working very well, and she would drag. It was Limu, and apparently she had a tumor on her spine, and this was near the end of her life. For a boxer, she was 13, I think. So
Which is old for a boxer.
yeah,
it's
and
not
so
the bigger side.
but she just never seemed like she was upset and angry about her back leg not working, and she was just happy.
Animals do process things very differently, and some of that does absolutely come down to the personality of the animal. I have absolutely seen animals become frustrated and start to self-traumatize a leg that is not working the way that it should.
Wow.
Now, we don't know whether or not that is genuine frustration, like mental frustration, or could it be that leg's not working correctly because of a neurologic problem, and because of a neuropathy and tingling, do we start to self-traumatize because it's tingling, it feels weird, and so we start chewing on it, then it becomes habitual, and then it becomes a major problem. But there are absolutely, and I mean, there are some animals that, unfortunately, we can't help them to the same degree that we can others because they are not as accepting of help. We definitely have animals that are very deeply proud, and, they don't want somebody to help them stand up. They don't want somebody to get their hands up underneath of them. And we don't really know, is that genuine pride or is that
That's
fear that it's
fascinating.
going to hurt when somebody lifts them?
Right.
But there are absolutely animals, and you are right. For the most part, most animals, they live in the moment. They don't realize that what they have is a disability. They just do what they can to, go and do the things that they want to do, and they just try to find a way to push through and persevere. And
You see that a lot in dogs that are missing a leg, like a three-legged dog. You see he's just hopping along, doing
Yeah.
his life,
Giving everybody high fives along the way, going, this is it.
Yep.
Wow, that's amazing.
Go ahead. Do you have a question?
Well, I was just going to get back to some of the things
Okay.
common things that owners miss. So we talked about, what was the first one we talked about?
dental disease.
Dental disease. So what are some of the others? I think bumps and making sure you're constantly, when you're petting your dog, feeling around for anomalies, because sometimes they'll get, fatty tumors, or they may be something aside from a fatty tumor, and just being able to identify those changes in your dog's body is, I think, very, very helpful.
It is helpful. And that is another thing that, just like the dental disease, it's not necessarily that it doesn't get noticed, but it tends to get written off, because I cannot tell you how many times I hear, it's a lab, they're supposed to have fatty lumps. It's not technically correct. Those fatty lumps are actually cancer. Now, there are two types of cancer. There's benign, which is it's not going to do anything to hurt you other than maybe the local damage that it could create. Or it is what I typically call big, bad, scary, ugly, which is the growth of this is going to completely alter some of the biomechanics, your immune system. It's going to spread, and it is eventually going to lead to a cascade of events that would force a final farewell. But, technically those growths are not normal. Growths on the skin are not normal. The skin tags that they get, they're technically not normal. There is a difference between normal and common. But normal is an animal that does not have any of those, which is the reason we are not born with any of those.
Right.
That's huge. So many people say, "I'm having my normal headache." Our patients will say, "This is my normal headache. This is my normal this and that."
They even go so far as to sometimes say, I have this horrific back pain. My dad had it too. I'm like, back pain's not genetic. I love you, but it's not genetic. You did something that changed the structure of your spine, and that's where that's coming from. But people just don't know what they don't know, unfortunately.
Chiropractors get a lot of discrimination, I guess. And so I wonder if you get some of that from regular, general practitioner veterinarians when they learn that you do acupuncture and you do spinal manipulation on animals. What's that been like, and how do you educate them?
Education, just like with anything else, is very difficult because a lot of times you are dealing with people who don't want to hear it. They've already got a very set mindset, and oftentimes you just have to go, okay, fine. All I can do is the best that I can do and kind of let it go. There is a lot of fear that comes around the integratives because usually, and just like with the chiropractic world, because I did have to learn a little bit of the history of the chiropractic world and the struggles that chiropractors went through to try to become something that resembles mainstream.
Right.
Nobody ever hears about when it works, but everybody hears about when it was a problem. And usually the problems, somebody will. A couple of years ago, there were a couple of horses that were killed at a show from somebody who claimed to be a chiropractor that was there doing adjustments for the show jumpers. and they adjusted a horse, and they didn't do the adjustment incorrectly, but they weren't a veterinarian. They weren't aware of what wobblers is. And they did an adjustment at an area that dinged the horse's spinal column because they had excessive movement, and the horse just collapsed. So what do you hear? Chiropractic kills horses. It's not the case. It was not somebody that was appropriately trained. It was not somebody that was and then because that person had zero training, no relief waivers had been signed, like absolutely nothing. That person didn't practice veterinary medicine, so they couldn't go after him as a vet. That, like, there was absolutely no recourse on that particular individual. So
but it hurts the profession.
it does. It
because
100%
you don't hear
hurts
the
the profession.
truth,
Yes. And you
right?
don't realize everything that goes into it. All you hear is that a chiropractor killed a horse and nothing got done about it.
For the record, it was not a chiropractor who
Yeah.
killed.
So, and there are a lot of people who will also, just kind of like watch what it is that we're doing, and they make assumptions about what we're doing. They start mimicking those things, and
gosh.
maybe they'll see a little bit of improvement because some of what we wind up doing winds up being some massage techniques. So, okay, fine, they are helping in some areas, but then you have that one case where it's not so much helping, and that person is not charging the same thing that a veterinary medical manipulator would be charging. So then you also are, you're having lay people who are going out and doing things, and that winds up hurting the profession because it also brings down the understanding of what goes into this and the
Absolutely.
degree of education that this takes and what that education costs and what that education does. So yeah, there are absolutely stigmas against the integratives that either they don't work or they make things worse. And that definitely comes both from the general public on the human side of things, and there are certain veterinary professions, like veterinary boarded professions like surgeons, neurologists, things like that, that will actively steer people away from it because they're not educated. They assume the worst because of what they've heard from these lay people.
Right.
And then, like, they're actively deterring people against seeking appropriate care with well-trained and educated professionals.
That's a shame because that's the dog is, or the animal is the one that suffers in that
Right.
case.
Yeah.
And I mean, we, luckily because of, the profession that you're in and having our practices, we knew the value of having our dogs, checked and having their spines aligned properly. We had one of our dogs suffered from ear infections all the time. And if we were to give her an antibiotic, she just ended up with a recumbent ear infection. It never went away. And we knew that just like with adults, with humans, you run the risk of compromising their immune system when you change their gut health, because our immune systems start in our gut. And so we had, before we had met you, we had another veterinarian who also manipulated, and man, it was just life-changing for that dog. She would adjust the ear, she would adjust the cervical spine, and we would literally see the dog start to swallow. Like all of a sudden it started draining just like it does in humans. And we're like, why would we not do this? It's saving her from, an over antibiotic use, which we know we've reported on in the past that there's been, especially in humans, such an overuse of antibiotics and overprescription of it that they've had to create a worldwide panel of individuals to go, how do we come back from this, because we've actually injured people. And so just knowing that there's a time and a place for all of that stuff, there's a time and a place for medication and for antibiotics, but if we try to use them all the time, they're not effective when we actually need them. So just like with humans, we have to be cautious.
Exactly. A pill is not going to go inside and move C7 where it's supposed to be.
Yeah.
Never.
And, surgery is when you change something on the inside of the body. But manipulation is when you change something on the inside of the body without cutting them open.
Right.
Why wouldn't you want that?
Yeah.
I mean, it makes perfect sense.
And that should always be the first course.
I
You know
agree.
what I mean? Not just because of, look at cost too, if we want to get really crazy with it. The cost of having to put your dog through surgery, we were just talking about that, or even the diagnostic. We live in a time which is fantastic that there's been so many improvements to what we can do with our dog's health. I mean, probably 25 years ago, maybe, and I'm just kind of guessing, I don't think that we would have seen like the MRI technology as it's vastly available right now, or these big animal hospitals that, when the smaller places can't don't feel like they can take on a case, they can send them, and they have, maybe more diagnostic equipment available. So there's just so much more available. But I'm like, why would you not want to go and do the thing that's the safest and the most cost effective first?
Yep.
And if that doesn't work, then you go to something more invasive. Like for me, that just would be common sense.
And what it often comes down to is because the vast majority of people do not have health insurance on their animals. A lot of people don't realize that health insurance even exists for animals. And the way that the insurance companies work for animals is you have to pay for everything up front first, and then the insurance company will decide if they want to reimburse you.
Right.
So the vet clinics don't work directly with insurance companies. You have to pay the vet clinic up front and then get reimbursed by the insurance company later. But it is often asked of veterinarians to, rather than get the conclusive diagnosis, we're oftentimes asked to make a presumptive diagnosis, because if we're right with all of that fancy schooling that we did, it's cheaper to just take the pill than to do the testing to prove that you need the pill. And unfortunately, you definitely have cases where you guess right, and your education has actually led you in the right direction, and you can treat some things that way.
Sure.
But there are absolutely cases where that doesn't happen, and people don't oftentimes become open or willing to the idea of doing the diagnostics, because you have to pay for them out of pocket to get that diagnosis if it's likely that the guess is going to correct it. So then you have to go through 4 or 5 guesses before some people will finally say, okay, fine, we're ready to do the diagnostics. And now you've sunk in $1,500 to $2,000 between vet visits, vet rechecks, medications. The problem is now much deeper ingrained because we weren't able to guess right the first time. So now it is a much more out of control issue than it was when it first was there. And that's oftentimes kind of the way that the veterinary community kind of has to go, because since you are paying for all of this out of pocket, and unfortunately what you wind up paying for is veterinarian time, staff time, keeping the doors open, the medication itself,
right?
Just a regular visit does wind up being a bit costly sometimes.
Yeah.
So then adding the diagnostics on top of that seems financially overwhelming, and
Absolutely.
it's unfortunate, but that is the way that it is.
Well, what do you think are a couple of things that every pet owner could do to help improve the health of their dog without spending, thousands and thousands of dollars? What are some things that are easy that we could be doing every day with our pets that will, we know that there's nothing that you can do to 100%, prevent everything. But like you said, brushing their teeth each day, can help reduce the risk of gum disease. So there are other things that we should be able to do wellness-wise that'll help us reduce the risk of having those major illnesses and disease processes with our animals.
So the 3 big things that I kind of advocate for is number 1, the brushing. Number 2 kind of goes with the brushing. Don't just brush the teeth, brush the whole body.
Okay.
Because if you are touching the whole body every single day, you're massaging over the body, which means even if you're not getting the adjustments, you're still massaging the skin, you're massaging the underlying tissue, you're helping with relaxation, you're helping with bonding. You're going to start feeling, is there an area that's twinging on a regular basis? That's an area of pain. Do I need to get that checked out? I should see somebody sooner about that. And maybe you catch that before your animal is now 3-legged lame and can't walk anymore.
Right.
It also helps you have knowledge of where are those bumps growing? How fast are they growing? 3 weeks ago, it was this big. Now it's this big. That's a problem. So you catch those things sooner. We actually see the skin. We kind of know what's going on with the skin. That helps us also check to make sure we don't have ticks that are transmitting diseases, that fleas are not starting to set up on our animal. And it's a really good emotional bonding. Animals have social grooming habits, and most animals live in a single pet household, so there aren't multiple animals there for that interaction and connection. So giving them that opportunity for this social grooming because you're petting them, it helps them with their emotional bond. That's also going to help you with feeling, is my pet gaining weight or is my pet losing weight? Because you'll be able to feel, are there changes with how well I can feel the bones? So working with your veterinarian to know what is an appropriate weight for your animal, how to monitor for that, so that way you can keep them at an ideal weight, doing daily brushings and groomings. And brushings doesn't have to be with a brush. You can brush with your hand,
Okay.
just petting your animal on a regular basis and with intention and mindfulness, not just absently stroking your dog's head while you're watching TV, but spending 5 to 10 minutes just running your hands over your dog every day and brushing their teeth is going to do so much for educating you
That's
on
great.
your animal, what is normal for them. And when you start noticing something, get them into a vet, catch it early. The earlier you can catch something and get it managed, the less likely it'll be a life-altering event.
That's what we tell patients too. The one thing you never want to do is go, I think it'll go away. Those are the 5 most dangerous words that you can speak. If there's something that feels out of the norm, it's always better to get it checked out than to wait and let it progress if it is something serious. So
So
I agree.
I have a fun question to ask because I know we're almost out of time, but it's a little strange, and I don't expect you to have knowledge on this, but there are these people who call themselves dog psychics.
Okay.
And they apparently can talk to dogs. So I'll give you the background to where this comes from. 20 years ago, I had a patient who had created a facility in his home where he would rehab dogs that have been that were going to be put down for bad behavior.
Okay.
And he would take them all in and not let them be put down. He'd rehab them and take care of them and keep them for the rest of their life. Or if they were safe to go back into a home, he would put them into a home. That was his career. He had fought in Vietnam. And in Vietnam, he said they had these dogs. If you got shot, the dog would come pull you out of the line of fire
Okay.
and keep you safe until someone got you. So he was shot in the stomach. And this dog came and grabbed his collar and started pulling, but he was too heavy and the dog couldn't do it. So the dog laid on his stomach, took 2 bullets for this man. Not only was he slowing down the bleeding on the abdomen, those 2 bullets would have hit him, but they hit the dog instead. And the dog never moved, laid on him and died right there. And he said, if I ever get out of this alive, and he was praying to God, he said, I will dedicate the rest of my life to taking care of dogs and rehabbing them and making sure they're good. So he had one dog that was very ill, and the veterinarian had recommended putting the dog down. So, but he wanted to know if the dog wanted to be put down.
Okay.
So he called this psychic, and maybe I shouldn't laugh. He called it psychic and said, ask him if he wants to die. And the psychic asked him, do you want to die? He said, no. Apparently, this is according to the psychic. He said, no, I don't want to die. And so he kept the dog alive for another few months. Eventually, the dog died anyways, and those were terrible months. And he said, I figured it out. The reason the dog said no and I want to stay alive was because the dog was worried about me, the owner, and didn't want to leave me alone. And that's why. And so the psychic confirmed it and all that. But anyways, so that's my story on dog psychics. But have you ever experienced anything or met one of these dog psychics?
I have never met an animal in the industry. They're typically referred to as animal communicators.
Okay. Yeah.
I have not worked with, spoken to, or had any interactions with an animal communicator. I have had many clients who have indicated that they have had communications with an animal communicator. Some have reported positives, some have reported negatives. It's not an experience that I have had.
Right.
So I don't feel that it's something that I can really speak to.
Right.
Everyone has their own spiritualistic beliefs. And if speaking with an animal communicator is something that somebody feels is going to help them make a critical decision for their animal, I would absolutely encourage them to do it. But what I would just like, if your Aunt Betty is a very intuitive woman and you always ask Aunt Betty for help or questions, great. But confer with a veterinarian as well, because even if this animal communicator is able to truly tap in and is able to communicate, there are 3 aspects to overall health. There is the physical, which is what most veterinarians tap into. There is the mental, which is what I feel like the animal communicators are tapping into. And then there is the emotional, which may be some of the animal communicator, but that's also going to be the bond with the human. That's what we refer to as the human-animal bond. if one of those aspects has completely left, either we are completely mentally void, we're emotionally void, our health is completely deteriorated and gone, our quality of life is massively in jeopardy. So even if there is still a will to go, but the physical is no longer allowing that, there are plenty of people that, are laying in hospice beds saying, I don't want to, but they do anyway.
Right.
At least with hospice, we're able to give them really, really massive drugs. So if you've worked with a communicator and they're saying that your animal is not ready to go, you need to be working with a veterinarian to make sure that that animal is as appropriately medicated and helped as possible.
Absolutely.
To make sure that that physical suffering is not there. And that's usually where I see the biggest lapse is most people make the assumption that if their animal is showing them signs that they're not ready to go, that has to mean that quality of life is good and they're not hurting.
Right.
And that's just not the case.
Right. And a lot of people, I think, there's a stigma attached to like taking your animal to the vet office and having to put them down, and it feels so what's a good word for it?
Cold.
Yeah. It doesn't feel personal. And
unemotional. Yeah.
There are alternatives that I think a lot of people don't even know about. I don't think people understand that there are individuals that will come to your home, vets that'll come to the home and actually allow that to be a different kind of experience. We were able to do that with 2 of our dogs.
Our last 2 dogs, a veterinarian came over and
vastly different experience.
Sedated the dog, and we got to say goodbye to her.
The kids got to be there.
The other dog laid next to her and
which
saw
helped
her
with the grieving process.
Yeah, she saw her best friend pass, and then she knew what happened. It's not like we took her
Right.
friend away
and never came back.
and she never came back. She saw what happened, so
which is good because she was an emotional wreck. That dog.
She
anyway,
was an emotional wreck to begin with.
But yeah,
So
we
that's
are
a whole
very
different-
fortunate that in this area we do have a few veterinarians who do offer in-home final farewells. I do that as well as a couple of others in the Frederick area, and then
Thank you.
there, depending, I don't know exactly where your viewer base is, but heading down towards DC and Rockville and Gaithersburg, there are a lot of veterinarians who do offer that, and most of us wind up getting referred to either when people ask for that service from their regular vet or through word of mouth with your friends. A lot of us you can find on Facebook pages. So if that is an experience that people are looking for, there are a lot of us out there
I
who
think
want to
it's-
help
it should be
provide
the only
that.
way.
yeah, I think it's a
So
great opportunity.
obviously we're going to put links to your connections, information, and so on, but how can everyone best contact you and communicate with you?
You can find me on Facebook.
Not with an animal
because
communicator. We'll use traditional methods.
people are welcome to reach out to me. I have all of my information listed on Facebook. I don't have a full-blown website,
Okay.
just because so many people, I prefer a very personal touch.
Yeah.
But my cell phone number is listed on Facebook, and I think both of your offices have copies of my business
Yep.
cards.
So
But
contact us
people-
if you have specific need for one of your animals.
Yep.
We'll put you in touch.
Absolutely.
Yep.
Absolutely. Well, thank you
Thank
so
you.
much for being here and providing such great information for our viewers at home, because we all love our animals. I love mine most of the time. She is annoying sometimes too, but it's important for us to know the things to look out for and how to best take care of them. So thank you so much for being here. We
Yeah,
You're
appreciate
quite
it.
welcome. Thank you for having me.
And next time we'll have you on, I want to talk about how animals can communicate. I'm loving all those videos with them hitting buttons and talking. I'm like so obsessed. So
Oh, she's I guess an animal psychiatrist also, not just.
Right.
Yeah,
Yes.
along added to the list. Anyways, take care, everybody. God bless you. Thanks for joining us.
bye-bye.
Thank you.